Thank you, everybody, for coming today. How was our lunch? Good. Wonderful. We like to focus on the food first. My name is Christina Campbell. I'm the Regional Manager of Community Engagement for University of Michigan Health-Sparrow, and we are so excited to bring back the Senior Health Series for you all to enjoy. So thank you for coming out today. They're really clapping for you. I am pleased to introduce the speaker for our first luncheon, Dr. David So. He is a board-certified orthopedic surgeon who specializes in hip and knee replacement and has been in practice since 2015. He's going to talk to you today about healthy movement, a variety of ways that you can stay mobile, that support your overall health and offset our opportunity for injury. You'll see just a few housekeeping items before I turn it over to Dr. So. There's a few different pieces of paper where you're sitting. Number one, if you did not bring a pen today, we do have some pens back at the registration table. Feel free to grab one at the end if you would like, or wave at us and we'll bring one to you. We would like your feedback. We would like your feedback as we plan ahead for continuing this series and doing more to understand when you're looking for them. There is a question about frequency on here, looking to understand how often you would like to see these. And if more than one apply, I know it says more than one apply, please feel free to circle a couple. If you have any additional feedback for us, feel free to write it on the back of the piece of paper or let us know. And then before you leave today, if you would just turn the survey in at the registration desk, you can simply set it up there. One other item, at your tables for the ladies in the room, there is another senior health opportunity up at early November at Alive, which is in Charlotte, home of University of Michigan Health-Sparrow, Eaton. This is, I believe, the 9th or 10th year that this event has run, and you will see a variety of providers from Sparrow attending this on several topics connected to women's health. The event is completely free, and I encourage you to check it out if you are not available. I had one of our attendees ask, is it a game day Saturday? Of course not. Not a home game. Not a home game. So you can still go to football, all right? And otherwise, enjoy today's presentation, and we look forward to getting your feedback. Thank you. Dr. So.
All right, well, good morning, good afternoon. It's really my pleasure and privilege to be here. Thank you for coming out, and really hope you can walk away with something helpful or insightful today. So welcome again to our University of Michigan Health-Sparrow Senior Health Series kickoff. My name is Dr. David So. I practice over at the Jolly Road Orthopedics. Been a Sparrow for a couple years. I am a native Michigander. So I was away after in practice for a few years out of state, but then came back to move home and be closer to family, and just really was fortunate to end up in mid Michigan, so central. So yeah, I'm excited to be here, share with you. I'm looking to provide some recommendations on strength and mobility, balance, and the importance of these, and as well as aerobic movements to help you maintain independence, to support your overall health, and to offset the risk for illness and injury. At the end, wouldn't be doing my part unless I shared some information about as well as what the orthopedics can do for you potentially. So if anybody can't hear me or needs me to speak up louder, don't hesitate to. Okay. All right. So let's see if I can get this working. So I'd like to thank Katie Hubbard. She works at U of M Health Plan. She's a certified health and well-being coach. She helped with some of these slides. So this is the website. So welcome. Out of curiosity, and if you don't want to answer, you don't have to. But if you're in your 50s today, can I see a show of hands? 60s, all right. 70s, all right, pretty even. Anybody in their 80s? All right. Look at that, pretty even there. Do we have anyone in their 90s today? Okay. So, and how many of you had relatives that lived into their 80s? So vast majority. That's excellent. 90s. Oh, hundreds. That's awesome. So, yeah. So in the U.S., the average lifespan, according to most recent data, is around 77.5 years. For females, it's a little higher at 80.2. And for men, unfortunately, a little lower, maybe because we're men. So, all of human history, or a lot of it, we've been looking for the fountain of youth, looking to extend our lives, to live healthier, but studies show there may be 5 fountains of youth. Has anybody ever heard of a blue zone? All right, so good, a handful, excellent. So these are areas in the world. Does anybody know? Can somebody give me an example of one? Yeah, definitely. There's a couple there. There's in Greece and Italy. In the U.S., there's actually Loma Linda out in California, and as well as Okinawa in Japan and Nicoya in Costa Rica. These specific areas are areas where more people live into their hundreds than in other areas in the world. So this was studied by Dan Buettner. Again, he identified these areas, and they really isolated nine traits that were consistent across these populations. So it's nine's a lot, but apparently these make a difference. Number 1 is purpose. So kind of the blue dot in the top right, it says purpose, just believe me. But yeah, the Okinawans call it ikigai. The Nicoyans in Costa Rica call it plan de vida. And basically just waking up in the morning with purpose. And so studies show that it can add 7 extra years of life. Another principle is to downshift, to really incorporate routines to shed stress, whether it's through remembrance of, family members, prayer, napping. So napping is still good. It's not just for the little ones. And even a happy hour, Next principle is called 80% rule. And really this pertains to how much we're eating. So rather than just, eating until you can't eat anymore, until you have, difficulty breathing or the meat sweats. Thank you. Hello? All right. So thank you. Okay. This is probably a little easier on the ears rather than me shouting. So thank you. But yeah, 80%. So, again, in Okinawa, it's really encouraged. You just stop eating before you're completely full. You stop at 80%. Often these communities are eating their smallest meal in the late afternoon or in the evening. And after that, they just don't have any more meals. Aligned with more today in our culture, intermittent fasting or things like that. There is a role for that. The diets in these communities are more plant favored. A lot of beans, fava, black beans, soy, lentils, and really only eating meat 5 times a month. So yeah, and small portions of meat at that, 3 to 4 ounces. None of these 18-ounce porterhouses, unfortunately. Wine at 5. So, except for the community out in Loma Linda, moderate alcohol, especially red wines with antioxidants, is consistently shown and seen in these communities. And belonging. So belonging in community, that's super important. So, hopefully you're here with friends outside of today's events. If you're involved in, whether it's faith-based communities, at church or temple or anything, it doesn't matter what denomination. These have been shown to add 4 to 14 years of life. Importance on loved ones first. So if you have your children nearby, grandchildren, just really that can believe it or not add 3 years. Sometimes it feels like they're taking away years, but that can add some years to your life. And besides family, belonging, belonging to finding the right tribe. So again, Okinawa, for example, they have very consistently 5 very close friends that you've had since you were little and all the way through your adulthood. And and the last one at the very top, the green dot, that says move naturally. So that's kind of why our focus. That's going to be our focus today. So all these communities, they're not just sitting back watching TV all day. They're getting out and moving. Whether it's like they have a home garden that they tend to daily, just really things that in their lifestyle that just keep people active. They don't necessarily they're pumping iron or running marathons in these places. It's just really that daily routine that's made a difference. So again, exercise, exercise, exercise. But so we'll talk a little bit about the importance and how it can counteract aging. So number one, exercise can strengthen the cardiovascular system. So it can lower blood pressure, so your heart doesn't have to work as hard. It can also make your heart more effective and stronger as well, and it improves perfusion, things like that. Number two, exercise can promote healthy skin. So you don't have to, get fillers or Botox. You can just exercise, a little bit cheaper. So it'll help increase blood flow to the skin, hair, nails, removes waste products. It can slow the aging process by increasing your body's own production of antioxidants. So just another thing to keep in mind. Exercise can counteract aging by helping regulate blood glucose and support a healthy weight. It's really encouraged that people, even after a meal, go out for an evening walk. That can really help decrease the spikes in blood sugar. And by doing so, it can help by exercising and burn the calories, reduce your appetite, can regulate the insulin in your body. These are all important things. Exercising, decreasing weight can decrease the risk of developing dementia, things like that. So number four, exercise can counteract aging by elevating your stress threshold. So studies out of University of Georgia shows that exercise can prime the brain and to show less stress in response to new stimuli. So by exercising, again, it can help you with an outlet to let out your stress, but it can also make you more resilient so that when you do, obviously life throws things at you, but you're better able to handle it. Exercise can improve your mood. It can provide extra motivation and can increase your energy level. So and this can help. This is in part by exercise helping counteract the natural decline of dopamine. These are chemicals that are in the brain. That helps boost motivation. And so number six, exercise can counteract aging by improving strength and it helps preserve bone mass. So we'll get a little bit more into detail on this, but again, exercise is important for a number of reasons. But in terms of just your body, it can help increase the bone mass. Resistance training, things like that. A study out of Harvard showed significant improvement in muscle function in octogenarians who started a weightlifting program. So believe it or not, it's never too late to start a weight training program. Exercise, as we age, sleep can be an issue. You may not sleep as long. You may wake up easier. But if you get some good exercise in, that can help improve your sleep quality. So it can increase the amount of slow wave sleep that you get. It can help stabilize your mood and decompress the mind. So when you're ready to sleep, your mind's not racing. You're just ready to get some good energy. My daughter still says that my battery's empty. I got to go recharge and I got to sleep. So things like that. So and exercise may be counterintuitive, but it can help reduce pain. Older, it's we get stiff. Things stiffen up. Things start falling apart after a certain age, but keeping movement. Continuing motion is super important for your joints. to keep the joint fluid bathing the cartilage that you have. Exercise can help increase the tolerance to pain that you, and the perception of, improve the perception of pain. Exercise can counteract aging by boosting the immune system. So it actually has an effect on the white blood cells. It can help increase activity of antibodies. So just get out and exercise. Lastly, it helps foster neuroplasticity. So this is, again, more improvement in brain function, brain axon connections that are experienced with exercise. So in terms of the brain, there's essentially exercises like Miracle-Gro. So there's a factor called BDNF, brain-derived neurotrophic factor. It's probably easier to say BDNF. And so this, when you exercise, the brain releases this compound, and this helps grow and protect nerve cells. This compound BDNF, it pools near the connections in the axons in the brain. It helps improve the transmittance of signals. And so almost immediately after exercise, aerobic exercise, blood and BDNF, they pool in the prefrontal cortex of the brain. That's the part of the brain that's responsible for making decisions, executive function. And so it really helps you kind of think more clearly, and it may help with if you have things like a project coming up where you need some extra critical thinking. So getting up, walking around, getting that blood flowing. More studies looking at aging, out of the University of Illinois. The study looked at, sedentary seniors ages 60 to 79. There were 59 in this group, and they split into two groups. One group would just go to the gym and just stretch only, and the second group, took on walking on treadmills. They started at a lower pace, 40% of their maximum heart rate, and ramped up to 60 to 70%. And so the group that was doing the treadmill, they had much more improvement. And the walking and the aerobic exercise increased their aerobic fitness. This is, how much the lungs' capacity to process oxygen. So basically, they're breathing better. They're getting more blood flow, more oxygen into the body. So not just stretching, but also really integrating, aerobic exercise. And so this exercise, also the same group, Dr. Kramer, they showed that exercise can increase the size of the anterior hippocampus, and this is important for memory. So this is something that you can take away as we age. May be more forgetful, but things that help improve that forgetfulness is exercise. So just another reason that we should get out there. So who should exercise? Basically, everybody here, myself included. I need to exercise. So anyone, any age, there's some form of physical activity you can do. If you may need to talk to your doctor to see what kinds of exercise you can do, but really just anything, whether it's, if you're, having lots of aches and pains, getting the, like a little exercise pedal device, while you're seated, doing, arm exercises with, resistance bands or low weights. Even if you have health conditions like heart disease or diabetes, that's maybe more important reason to actually start exercising or continue exercising. For most adults, brisk walking, riding a bike, swimming, some weightlifting, even gardening that we talked about earlier. These are safe, and especially if you build up slowly. Don't just decide one day, okay, I'm fully committed, I'm going to go do it, and just jump 100% into it. You may want to ease into your exercise. So again, for many conditions, exercise is preventative medicine as well as the antidote. So this slide here is from, I believe, the Center for Health and Human Services, but really adults in general, it is recommended that we participate in 150 minutes a week of moderate intensity aerobic exercises. Doesn't have to be all at once, you can split it up. And as well, combine that with muscle strengthening activities. So that's at least 2 days a week. And as for our older adults, add on top of that, activities to improve balance. And balance is super important. There's a lot of different things that can affect your balance. Whether it's anything from eyesight, parts of your inner ear. There's different things, your cerebellum. But improving balance can help minimize the risk of falling, which can obviously lead to many different big problems. So really, it's the three things: aerobic activity, exercise to work on the heart muscle, muscle strengthening to work on your body muscle, and then balance to work on your brain muscle, essentially. So again, you think you're too old to start exercising? So these are some examples. I actually read the story on the left a while ago, but that's Ernestine Shepherd. She looks great. She didn't start exercising until she was 56, and now she's 88. So she wakes up every morning to run and lift weights. She does 5Ks. She can run 5 kilometers in about 28 minutes. That's very fast. She's finished 11 marathons. She benches 150 pounds. She's won a building contest in a bodybuilding contest in 2008, and she beat many younger women in this competition. And she doesn't even take supplements because she doesn't doesn't know what they're going to do to her old body. Impressive. So you have Anna Pesky. She is 86 years old, and previously she had significant changes in her posture. You can see her kind of hunched over. And what she did, she tried everything, a lot of things: physical therapy, just exercises, chiropractor. Those didn't work. What worked for her was doing yoga. So you can see the difference that really made for her in her life. So yoga can help work on posture, core strengthening, those kind of things. Everything starts with your core, and so that's you can see a really great example. And on the right, you got Fauja Singh. He ran his first marathon at 89. Yeah, and he's still running at 113 years. Unbelievable. So, in other words, get moving. I don't have any excuse. That's clear. But so, primary goal is to find something that you enjoy and that you're going to do on a regular basis. Don't make it something dreadful. Choose an environment that's comfortable and familiar. Mind-body activities, again, yoga, tai chi, super important for balance and relaxation. If your fitness level is low, start somewhere. Start 5 minutes, 10 minutes, and gradually work up. So remember, keep in mind, something is better than nothing. So, okay, so again, what exercises should I do? There are 3. We'll start off with the weight-bearing exercises, and walking, jogging, running if you can do it, tennis, paddle sports, things like that. Climbing stairs or dancing. These are kind of the aerobic exercises. So the combination of the aerobic exercises, muscle building exercises, and balance exercises, they can help minimize the risk of falls and fractures, and they can help maintain healthy bones. Okay, so number 2, resistance training. So, you got to make your muscles work harder to become stronger. Muscles attached to your bones, via tendons, that when the muscle's contracting, it pulls and the bone sees force on it. And force, and they will activate. And then they'll respond to the forces and make the bone stronger. So this is why, resistance bands and weights are super important for building muscle, and the muscles will help make the bone stronger. So again, you can use weight machines, free weights, bands, your own body weight, push-ups, pull-ups, squats, things like that. And then balance training. So again, Tai Chi, yoga. Some of these you may, if you're worried about your balance, may want to work with a physical therapist and do some of these. Walking on an unstable surface sounds kind of dangerous, but may help. Walking backwards carefully, that can help improve balance. Things like that. Even just standing, shifting your weight back and forth. It may look like you're fidgeting, but you won't get in trouble. Okay, so just that'll help with your balance. So safety tips, again, start slowly, especially if you haven't been active for a long time. Use safety equipment. If you're going to go out for a bike ride, safety first, helmets, right shoes for if you're going to go running or jogging or walking. Unless your doctor has you on a fluid limit, make sure you stay well hydrated. Exercise should not hurt, and it shouldn't make you feel really tired. It may be, working a little too hard if you're kind of getting to that point. But again, bottom line, start slow and listen to your body. In general, as we age, got to throw in additional safety tips, at the house, minimize the trip hazards, tuck away the loose cords, secure any loose rugs, and, consider, even future-proofing the house as we're, living longer, having more healthy. Okay. So, because falls, fall risks, these are very serious things. Falls are, leading cause of injury for adults 65 years and older. In the U.S., there's over 14 million falls every year, so that's 1 in 4. So, that's pretty significant. And they're the leading cause of fatal and non-fatal injuries among older adults, more than car accidents, things like that. And so, from 2012 to 2021, the death rate has even increased by 41% when related to these fall injuries. That equates to 41,000 deaths a year. And out of those, there's out of all these falls, there are 3 million emergency visits. A third of patients will stay in the hospital. 150,000 hip fractures occur a year. And this leads to $80 billion. That's a huge number, I can't even imagine, but that's in medical costs just related to falls. So again, all these things that we're talking about today can help decrease the risk of falling, needing this critical care at the hospital and all the downstream consequences. So if you're worried about falling, talk to your family doctor. Talk to me, and we'll help you out. So, kind of about these injuries, how many people play pickleball? Okay, all right, there you go. So, I have every year, I have more and more patients asking about pickleball. So, but I don't play, so I'm in good company then. But so, I thought I'd throw this in, maybe not relevant, but so it's been picking up though. You hear about it, so. Kind of gloss through this, but it's basically one of the fastest growing sports. A lot of injuries that can occur from pickleball, but any kind of tennis sport, racket sport. You can get wrist injuries, ankle injuries, tendonitis. You can even get eye injuries and heat exhaustion and those kind of things. You get a number of sprains and fractures even. And so, yeah, just be careful if you're going to pick up pickleball. So, if you're going to be out there, get in your ready position. Again, avoid backpedaling. Those are things that may lead to tripping and falling. And don't play too long, as even though you may be having a lot of fun, just don't overdo it. And this kind of goes to anything, whether it's pickleball or golf. In terms of when I see patients in clinic, obviously being a surgeon, we will do hip and knee replacements. Big question is, how soon can I get back to sports? There's not super great evidence or studies, but in average, after knee replacement, about 3 months is probably a reasonable time frame to start back with your activities, especially if you're doing the activities before surgery. Some higher demand activities may require even 6 months after surgery. So okay, exercise, it's all well and good. So, but how many people here have like aches and pains that sometimes prevent you from exercising? Okay, yeah, so it's a good number, and it looks like that's pretty proportional to the number of adults in the U.S. that may be afflicted with arthritis. As we get older, 65 years and older, it may be about 10% of people out there that have really symptomatic arthritis. So, what do? You still got to exercise, So, maybe do, I always recommend people do more low impact activities, whether it's an elliptical machine, swimming. When I was in medical school, we had a couple of general surgery attendings, and they would take the stairs up to the 8th floor every day, and the surgeons were in their 80s. So, and their secret was swimming. So they really, I took that to heart. Well, not too much because I don't swim, but I know I should. So swimming. All right, that may be the fountain of youth. Weight loss treatments. A little plug for our Lansing Bariatrics and Weight Management program. But weight loss, that can help take pressure off your joints. Your low back, your hips, your knees. Those are weight-bearing joints. And if you can take off, 10 pounds, that's upwards of 50 pounds less force going across those joints. So you may be able to do more exercise and with less pain if you're able to lose some lbs. Physical therapy. So it's not torture. May feel like it, but it's super important. If you have aches and pains, the therapist can help guide you and modify your exercise routine. And really, even small differences in whether it's your foot position, the way it's rotated, how deep you're lunging or exercising like that, it can make a big difference in terms of pain. And the physical therapist can be the treatment itself for any joints and aches and pains. Sometimes it may take some medication. We start with the least invasive, and we work our way up in terms of treatments. If you want to keep it more natural, there's some anti-inflammatory properties from turmeric and curcumin. Mobic. How many people are on Mobic now? Okay, all right. You don't have to raise your hands if you don't want to, but it's okay. That's strong, good, long-lasting anti-inflammatory that can help you keep you moving. If those things don't work, then we're talking about injections. There's steroid injections, and then there's a gel injection. You may have heard of the rooster comb injection. So that's basically hyaluronic acid. It's found in the rooster comb. It's also a compound that's naturally in your knee, so it's not just totally random. But basically, it's concentrated and injected back in to kind of help lubricate things. And bracing may or may not help. Bracing it's something that patients may ask about. What can I do to help? If it's a knee sleeve that you pick up from the sporting goods store and it provides some warmth and comfort, that it's not going to cause any harm. It's not going to provide structural support, but it may be something that if it's going to help you move it, keep on moving, then go for it by all means. A brace that's structurally going to change things is going to be bigger and bulkier. You can see this. It's almost like when you watch NFL, football or college football these days, all the linemen have braces on their knees. These are really structural braces that can help change the alignment. So that may be something that some people may benefit from. There's more kind of research kind of oriented treatments, not necessarily paid for by insurance. So they can zap you, and you may or may get lucky, may not get lucky and have improvement in your pain. And then there's surgery, so if you're having, hip or more likely like knee arthritis, that's symptomatic. Knee scope might not necessarily be the best fix, but if you have what's called a meniscus tear, that could be something that could be addressed with a smaller procedure. And then there's joint replacement. So again, we got to, as we get older, parts wear out, and then fortunately these days we can replace those parts. So whether it's a hip or knee or ankle, shoulder, things like that. So, the last thing we're going to touch on are some advances, some leading edge kind of things in surgery and orthopedic care. And really, we're talking about, same-day surgery, really shortening the hospital stay, lessening the risk of catching something while you're in the hospital, and, patients can recover in the comfort of their own home. So, joint replacement, 50 years ago, you'd be in the hospital for a couple weeks, and really the paradigm has shifted, and, so it's really come a long way. If you Google joint replacement, hip replacement, you may see something about anterior approach. This is potentially something that can help accelerate your recovery. And let's see, you may come across somebody who's had robotic assisted surgery, or, you've seen something, an advertisement about that. It still, isn't standard of care. It is something that is out there. You know, I'm not a big proponent for it, but you know, if you Google it, you may see something about robotics and joint replacement. You know, you can always ask your surgeon more about it if you're curious. I think a big thing that has changed for knee replacements specifically has been just the way we put it in and putting in knee replacements anatomically. So before it was kind of a cookie cutter surgery and doing the same thing, same alignment for everybody. And now that has really shifted. And, you know, in terms of joint replacement and specifically knee replacement, really implant position based on the patient's anatomy. And that has shown significant improvement. So, you know, for folks looking for some resources to get started, there's a number of places you can go online. You can go to Nike Training Club, Fitbit if you got one of those. Silver Sneakers has programs in the community. You know, we have our U of M, Sparrow Orthopedics, you know, website, and if you need to see a surgical consultation, lots of things out there to keep you moving. So again, remember, sticking with it is easier than starting over. So stay motivated. Take it one day at a time. Surround yourself with family, friends, positivity. Have a purpose. You know, have a vision. Keep your goals in front of you. Reward yourself. You know, work hard. Stay active. You know, this is all an investment in yourself. Believe in yourself and acknowledge your positive attributes, your commitment to healthy living. Recognize your progress, visualize accomplishing your goals, always be kind to yourself, and don't compare yourself to others. You know, do what you can do. So in conclusion, regular exercise can help positively affect cognition, brain function, help improve your overall health, decrease complications from chronic disease, can help decrease stress and anxiety. It can help boost your mood, improve your resiliency, and if all else fails, orthopedic surgery can help keep you moving. So, all right, so here's some resources, but thank you so much for your time and your attention. If anybody has any?
Can you tell me again what does BDNF stand for?
Yes, brain-derived neurotropic factor. Let me put that back on there because that's a mouthful. Okay, that's brain-derived neurotropic factor. I can write it down for you later. Okay. Anybody else?
Are the slides available anywhere online?
I can probably work with our folks here and see, because you know there are some links, so I'll work on it. Okay. All right. Sorry. Go ahead.
I wasn't sure of your question. Is there a way to get information?
Yeah. Sorry. Let me read. Yeah. The slides. I'll work with our department. Try to get them online, make them available for everybody here.
We can do that. Yeah. We'll work with Dr. So to get some of the resources. The other thing I neglected to mention at the opening of the presentation is we did live stream this on social media for folks who were unable to attend in person today. So once the live stream ends, that will be encapsulated as a recording that you can go back and see.
Yes.
Can you go over the knee injection things again?
Yeah. So again, when we're talking about knee pain, knee arthritis, we're going to go over the questions about going over the injections again. And so there's the main injections. There's two types: a steroid injection, that's also called cortisone, or a corticosteroid. There's lots of different brands and formulations. You know, Kenalog, which is the same thing as triamcinolone. Number of them. So that's a strong anti-inflammatory, and that can help decrease swelling and pain. Usually, it's in my practice, we'll provide that for patients with severe arthritis. You know, there's always side effects with everything that we do. So that one is a stronger medicine, but your blood sugar temporarily, increase blood pressure potentially, and other things. The second kind of injection that, the reason that the picture again has a rooster there, is that the rooster has a compound in it called hyaluronic acid. There's different companies that make that, Synvis, Uflexa, Hyalgan, etc. But then that one is basically that compound's concentrated, injected into the knee. It may take one injection, it may take 3 separate injections, or even 5, depending on the company. But that can add, it acts like oil between the moving gears in your knees to help lubricate. That one, if insurance pays for it, patients may be eligible for that every 6 months.
Okay.
So ideally, it will work for at least 6 months. When we talk about steroid injections, oftentimes we hope for 3 months at least. But it may be shorter, it may be longer, depending on the situation.
It was good for me for about 2 years.
Oh, see?
And then they weren't effective, and then I had knee replacement. Now, I think I'm having trouble with my hip. I have an appointment already coming up.
Okay.
But is there that type of injections for hips also?
Oh, yeah, good question. So the medications that we provide, they have to be cleared by the FDA, and they have certain, uses that are approved. That one specifically is only for knees, unfortunately. So if for hips, if there's bad arthritis, a patient either doesn't want surgery or not, healthy enough or ready for surgery, you could do a steroid injection into the hip joint, though.
That's not normal, though. You would normally go ahead with the surgery if it was called for.
I tend to, talk to the patient. I would talk to you, see what you have going on in life, how bad your symptoms are, see how bad the x-rays look, and realistically what you can expect from each treatment. If something's going to be, futile, it may not be worth, doing it. So it's kind of a case-by-case thing. Yeah. Yep. Yeah.
My question is it if you've had knee problems, like I haven't had a meniscus in my one knee for years.
Right.
But I walk, every day and things like that. I've kind of put off trying to do a knee surgery thinking that there's going to be more advancements. Is it better to put it off, or do you think?
Well, there's a lot of factors that go into it. Ultimately, are you still able to exercise? It sounds like you are. How much pain can you tolerate? If you go on your walk, but you're miserable for a couple of days afterwards, then it may not be worth just putting up with it. But if it's not holding you back, then the X-rays aren't showing catastrophic wear, to the point where if we were to do surgery later that it would be like way too hard, then just keep on going. I think that less is more. I think surgery is invasive. There's risks associated with it and things like that. So.
Well, it really didn't need the meniscus anyway.
Well, I mean, yeah, exactly. The meniscus, it serves a function. So again, the meniscus is like a little shock absorber in the knee, helps guide the motion of the joints. Sometimes it can lead to arthritis, when it's removed in its entirety. But again, if your symptoms aren't really holding you back, then that's good.
Thank you.
Yep. Yes, ma'am.
Joint pain can it come on immediately? Like,
Yeah.
you've been walking 5 minutes, all of a sudden you can't walk.
Yeah. So the question is, can joint pain come on immediately? Yeah. So I'll often see that. Over time, things wear out. Osteoarthritis is, specifically when the cartilage whittles away. It's like the tread on the tire, and you may be able to compensate, for years and years and years. But sometimes, it's not uncommon for a patient to come in the clinic, and there may be nothing that they could recall, or maybe it's something very mundane. But then it's just, you're never quite the same. Your body's able to compensate up until that point, and then sometimes the symptoms just never go away. So it could happen.
Thank you.
Yep.
Also, can you stop kneeling after knee replacement?
Okay, very good. How soon can you start kneeling after knee replacement? So, you have an incision on your front of your knee after knee replacement. Number one, you want that completely healed. I would recommend not having like scabs or anything before you really get down on your knees. So that alone could be, 4, 5, 6 weeks. And then, but once the implants the knee replacement is in there, it's solid. You're kneeling on it is not going to hurt the knee replacement. What I see is that, after surgery, there is scar tissue in the joints, and then kneeling on that can be uncomfortable. So, if you can tolerate it, it doesn't bother you, as soon as the incision's healed, I think kneeling is okay. If the knee is sensitive, you may need like a pad to put down on the ground or things like that. Oh, yeah, go ahead. Mm-hmm. Yeah. So, for a group, that's a great question. Individuals, obviously, if you come in the clinic, we can, send a referral over to physical therapy. If it's specifically like treating an issue, in terms of just, exercise, that kind of thing. We have a list of resources, we'll make it available. I think that's something that, our office, hopefully in the near future, will really get out there to get that information. At this point, we don't have like a pamphlet, as far as I know, but that's a great question. So I will take that back to to the office. Yes, ma'am.
When you were talking about prescription drugs,
Mm-hmm.
you mentioned the one Mobic or something
Yeah,
like that.
yeah.
What is that more effective than like Celebrex? Does it have the same problems like stomach issues?
Yeah. So any NSAID can. So the question is, what is Mobic? That's also called meloxicam. That falls under the class of medications, non-steroidal anti-inflammatory drugs. So those are other NSAIDs are also like Advil or Motrin or ibuprofen, Aleve, Celebrex. So Celebrex and Motrin, may have a little bit less side effect profile than the other ones that I mentioned, Advil, Motrin, and Aleve. But all of them carry that kind of, risk of upsetting the stomach, having an effect on blood pressure, even a kidney function and things like that. But the benefit of that one is, if you have your aches and pains and they're all day, every day, the Mobic medication is taken only once a day. So whereas, if you need Advil, you'd have to take it three times a day to get all day coverage. So yeah, it can be. I mean, maybe the lower dose can potentially lead to less side effects. So. Okay. All right. Looks good. So thank you so much. Again, appreciate your time and your attention.
We will work with Dr. So to get some of his materials and email them back out to you. I think that's probably going to be the easiest way to get them in your hands, since email is how registration occurred. But you can always visit the site and we may find a way to post them there as well. Again, thank you for attending today. This will be online on social media. Please turn in your survey and have a great rest of your day. Thank you. Thank you. Thank you so much. That was
No
great.
problem.